Every meal, every snack initiates a complex dance within your body. Glucose or blood sugar is the primary fuel, and insulin, released by your pancreas, is the essential key that unlocks your cells to let that fuel in. This elegant system works flawlessly until the communication breaks down. Diabetes, particularly type 2, is a global health crisis, often progressing silently for years, robbing individuals of energy and vitality. It's not simply about high blood sugar. It's a breakdown in this fundamental communication between insulin and your cells. This initial communication failure is known as insulin resistance. Imagine your cells as millions of tiny homes, and insulin as the key to their doors. When you eat, sugar enters your bloodstream and your pancreas releases insulin. This insulin should unlock your muscle and fat cells, allowing glucose to enter and provide immediate energy. But with insulin resistance, these cell doors become stuck, unresponsive to the signal. The insulin key no longer works efficiently. Sugar accumulates outside the cells in the bloodstream, unable to gain entry. In response, your pancreas works harder, much harder. It frantically produces more and more insulin to try and force those doors open. This leads to chronically high insulin levels, which itself causes further problems, including weight gain and increased fat storage. Eventually, the insulin-producing cells in your pancreas, called beta cells, become exhausted and begin to fail entirely. This is when blood sugar truly spirals out of control, leading to a clinical diagnosis of type 2 diabetes. The consequences extend far beyond just blood sugar numbers. The high concentration of sugar creates a state of chronic inflammation that acts like acid in your veins. This damages your blood vessels systemically, affecting both large arteries, macrovascular damage leading to heart attack and stroke, and tiny capillaries, microvascular damage. This microvascular damage is what leads to diabetic retinopathy, kidney failure, and neuropathy, the painful, debilitating loss of feeling in the feet and hands. Your eyes, feet, and even your brain suffer severe, irreversible harm. So, what initiates this catastrophic breakdown? The primary culprits are often a relentless overload of refined carbohydrates and sugars in our modern diet, combined with a sedentary lifestyle that promotes excess visceral fat. This deep abdominal fat is not inert, it's metabolically active, releasing inflammatory chemicals that directly contribute to insulin resistance, trapping you in a toxic cycle. But there is powerful hope. The solution lies in restoring this delicate metabolic balance. It begins with your diet. By choosing whole, unprocessed foods rich in fiber, lean protein, and healthy fats, you drastically slow down glucose absorption. The fiber in particular acts like a net, regulating sugar release and easing the burden on your pancreas, allowing your cells to become sensitive to insulin again. Equally vital is movement, especially resistance training. Your muscles are your body's largest glucose disposal units. When you activate your muscles through exercise, they act like a sponge, drawing glucose directly from your bloodstream, often without needing insulin at all. Even a 10 to 15-minute walk immediately after a meal can dramatically lower your blood sugar peak. Consistent resistance activity can literally resensitize your cells and reverse the progression of insulin resistance. By adopting a diet of whole foods, embracing regular movement, and actively reducing excess visceral fat, you can restore your metabolic health, reduce chronic inflammation, and bring your body back into balance. This is the evidence-based path to preventing and even reversing type 2 diabetes. Master your health by mastering your metabolism. If you are ready to understand the science of your body, subscribe to VITALYSIS for more deep dives into the biology of aging.